There is a genetic secret hiding in plain sight. It impacts half of Americans, fully half of the US population. It is linked to brain fog, fatigue, mental illness, and even infertility, the inability to have a baby. The usual advice that your doctor might give you, if they talk about it at all, is the exact opposite of what your body needs. In this video, you'll learn why doctors don't talk about this and the one common vitamin that you absolutely need to avoid. I'm Dr. Amy Newsel, and I'm obsessed with MTHFR because I have it. Over the last 20 years, I have helped thousands of mutants just like you and me through books, courses, coaching, and the To Health With That podcast. You need to know about MTHFR because half of the population has it. I mean, I'm not talking about a 1 in 100 people situation here. This is literally half of all people. So if you are sitting in the room right now with another human, one of you two's got it. That is kind of a big deal. This is incredibly common in the US population because we are such a melting pot, right? We have so many different genetic lines from all over the world meeting in one place. And this mutation is especially prevalent in populations who originate in places with, say, malaria exposure or a lot of sunshine. So I'm talking like Mediterranean Rim, that's the Southern European countries, Latin America, Hispanic populations, it's incredibly high, South Asian, right? Like this is very, very high in those sunshiny lineages. So if that sounds like your family tree, I mean, even if it doesn't, it is also in other populations, just to a lesser degree. So this is so common, right? This is something that you need to find out about yourself. If you know or suspect that you have an MTHFR mutation and you need a little support, click the link in the video description. I can help. We know 50% of the population has it, right? 1 out of every 2 folks, right? So somebody who lives in your house has got it. It can't be true that doctors aren't telling people, right? That can't be right. Well, actually, doctors are testing more people now for MTHFR than they ever have in the past, especially in the context of mental health or fertility or abnormal blood clotting, right? So things like a stroke in a person that shouldn't have had one, or a deep vein thrombosis or pulmonary embolism. So doctors are testing a little bit more, but the problem is they don't have a great option to fix it. In fact, the medically recommended treatment, which is high-dose folic acid, right? So they're saying MTHFR means you can't process folate. So just take a higher dose of the folate that we're familiar with. The problem is that actually makes the situation worse. It makes symptoms worse. It makes the patient feel worse. It does not help. It actually harms. So if you were a doctor and you saw that the only treatment you really knew about to give your clients with this MTHFR actually made them worse, would you talk about it? I mean, I wouldn't. That sounds terrible. That's not what doctors get into medicine for. They don't get into medicine to make people worse. Of course you wouldn't talk about it. They usually don't either. I cannot even tell you how many times I've had patients come to my office saying, look, everything tests normal. My doctor doesn't know what's going on. They can't figure out why I have symptoms. Nothing they've done has helped. And we actually go back through the testing that's already been done. And there it is, bold as brass, MTHFR. But did their doctor tell them? Nope, usually not. Or if they did tell them, they said, oh, you've got this genetic variant, but it's really common, it's normal, it doesn't matter. Not helpful, guys. Not helpful. The problem here is that medical standard of care follows 10, maybe 15 years behind the research. And even though the research says that folic acid and its byproducts make the MTHFR enzyme slower, doctors still suggest folic acid because overall it's the form of folate that has the most research. So they think they're doing the best thing. They're not. Also, medical training on this, not so good. Doctors know that with MTHFR you have trouble converting folate to the active form. So just take a bigger dose. You'll convert more of it. That makes logical sense. Yeah. They aren't trained enough to know that being able to activate folate or not being able to activate folate also affects methylation, which is like one of your foundational pillars of health. So the truth is, because MTHFR is considered a normal gene variant, which it is, it's so common in the population, right? It's normal, rather than a disease, which it isn't, then it isn't really your doctor's job to fix it, right? That's not their thing. They don't fix normal, they fix diseases. But this is not a disease. So it is my job, though. This is definitely my job. So if you're struggling, click the link, I'll help. So your doctor tested you and you don't have MTHFR. Well, great. You don't need to care about this, right? Wrong. Sorry. Folic acid can actually cause the same problems in genetically normal person as you would have with MTHFR. So folic acid, actually, when you take a dose above 200 micrograms, which is not a very big dose, you can get that from, I believe, a couple of slices of bread, because bread is fortified with folic acid. So you eat your couple slices of bread, you've got your 200 micrograms of folic acid. Your body can't convert that much because it has to go through a really slow enzyme. So it builds up as something called UMFA. UMFA, U-M-F-A, stands for unmetabolized folic acid. UMFA inhibits the MTHFR enzyme. So even if your genes say your MTHFR is normal, if you've got this floating around, then it just puts a stop on enzyme activity, which means you now have something called pseudo MTHFR. Sorry, kids. So for people with MTHFR, even a small dose of folic acid is bad, right? Because it makes the enzyme that's already slower. For people without MTHFR, a decent sized dose of folic acid is bad because it makes what was a perfectly functioning enzyme not functioning anymore, right? It gives you pseudo MTHFR. If you don't have MTHFR, you can probably tolerate these small doses of folic acid. But if the dose gets higher than 200 micrograms, which is every dose you'll take in a pill form, doses in birth control pills, more than a couple slices of bread, yep, all of those doses count, then you get pseudo MTHFR, meaning it slows down your enzyme and you get the same symptoms. Fatigue, right? You're tired, you don't have any energy, you might have weird body pain or like pain that nobody can really explain. Your fertility goes down. Yeah, sperm count's getting lower, gentlemen. Sorry. Ladies, yep, that cycle is not going to be as good for you. And also mental health stuff, right? So depression, anxiety, all the things. We don't want that, right? None of us want that. So basically, the point of this, folic acid is a no-go. And that's a big deal, right? With MTHFR or without it, because your doctor is never going to tell you this, right? Your doctor is never going to say those words. Do not take folic acid. That's never going to happen, right? You need to advocate for yourself. You need to advocate for yourself, especially if we're talking prenatal vitamins, right? Because you're working on fertility. You don't want to take something that actively blocks fertility. That does not make sense, right? Or if we're talking about anybody with mental health disorders, or if you're tired, if you're fatigued, okay, try switching it up because something isn't working. If you need help, click the link. I am here. This is what I do. Otherwise, just remember, folic acid is not your friend. There are other forms of folate that are better for you, whether you have MTHFR, 50% of the population, or whether you don't, the other half.